this side. All right. I'll place this hand on your back and this here. All right, just remain quiet as you can. I'll be listening here through my stethoscope, and I'm just listening. Hello, hello. Welcome to the Vermilion City Pokémon Center. How are you doing? Well, I'm sure if you are here in the Pokémon Center today, you've been doing better at some point, right? Of course. So, let's see what we've got here today. It looks like you are on referral from the Universal Pokemon Lab in R&R City. Yes, that Pokemon professor is a good friend of mine. We'll get you taken care of properly here. It looks like we are seeing you for a pre-existing leg injury from a Turtwig headbutt. Those can be quite nasty. How is your Pokemon feeling today? Right, so you just started your Pokemon journey, so I can assume you haven't done any real battling yet, unless you did it there on the ship. Alright, that's fine. We'll still get a generalized checkup of your Pokemon today and make sure they are in tip-top fighting shape. That way you can get out and start training as soon as possible. We will have our friend Chansey here take care of your Pokemon in the Pokemon exam area, and we will take care of you right here. How does that sound? Alright, that's great. So, I think that's all we have in that area. Perfect. So, Chansey, please take our guest Pokemon to the exam area now. Thank you. Your Pokemon will be back in no time. Let's go ahead and get a few brief questions here. So, let's start with, when was your last general checkup? Okay. And was that in R&R City? Perfect. Next, do you have any new symptoms from that leg injury, or are things about the same as they've been? And how long have you had that injury? Oh, really? Okay. And how would you rate your scale of pain, from 1 being the lowest to 10 being, you can hardly stand the pain? Anywhere in there? All right, perfect. I know it can be kind of hard to rate that just because everyone's a bit different, but that's perfect. All right, and last question. Have you developed, or has your Pokemon developed, any symptoms recently of the Pokerus virus? Okay, that's great. It has been going around quite a bit, so we've had to start checking all of our patients for it. We'll run a few brief tests to make sure that there are no lingering signs of it. All right, so what we will do now is we will go ahead and take you through a general checkup, and we'll make sure that you are completely healthy for your journey here and ready to face all of the trials that Kanto is known to provide any trainers that are brave enough to challenge the Indigo League. We will therefore be checking things like your heart, lungs, eyes, some brief cranial nerves. We'll check your temperature, blood pressure, and get that leg ready to be on its way, and possibly even on a bike. That's the goal. All right. So the first thing we will do is, I do want to make sure that there is no Pokerus virus hanging around there. So we will simply use this scanner device here. This, with a click of a button, will allow us to scan both sides of your head here to make sure that the Pokerus germs are not attached here to you. And Chansey will be doing the same to your Pokemon with the help of Nurse Joy. Alright, this won't hurt at all. You may just hear some brief sounds here on either side. Are you prepared? Perfect. Okay, just bear with me here. We'll start here on your right. And we'll just let that scan here. That shouldn't be much of an issue for you. Almost done. Perfect. All right. So now we will do your left side. Coming in close here. Here we go. Perfect. And we are getting a nice, thorough scan. Let's get in on this side. All right. Okay. And perfect. That's just what we want to see. A negative. So no Pokerus on your person, and I'm assuming, since you have not contracted it, since it is so contagious, I'm assuming that your Pokemon is free and clear as well. So that is a great sign, and that means we will have no need to do any kind of treatment for that at all. So the next thing we will do is we will go ahead and take your blood pressure and make sure that you are feeling absolutely at your best. So allow me here. We will utilize this blood pressure cuff. Have you used one of these before? Okay, so what we will do is we will take this cuff here and we will simply slide it over your arm, and we'll make sure that it's nice and snug. This will allow us to get a great reading on the blood pressure through your main artery there in your arm. We will utilize this pump, and this will allow us to inflate the blood pressure cuff. We will then use our indicator here, our gauge. This will show us just the amount of pressure that is going through your artery there. What I'm looking for is I'm going to inflate this until it is quite snug on your arm. It won't hurt, but it will be quite tight, and you'll feel that pulse begin to strengthen. What we will then do is I will slowly twist this knob here and slowly begin to let that air out. The first sound I hear when I'm listening with my stethoscope will be the top number on your blood pressure, your systolic number. And the last sound I hear before it subsides is your diastolic blood pressure reading. And those two numbers put together will give us an accurate reading of your blood pressure. So I will first apply the cuff, then I will ready my stethoscope. Are you ready? We're just going to get this nice Velcro cuff here around your arm. Not a problem. So I will ask you to give me your left arm. Put it straight out for me there. Perfect. Let's go ahead and get that nice and tightly around there. Just give me one moment. Sometimes these can take a little bit of time to get on there just right. Hold that arm still for me, please. Perfect. Thank you. And got it. All right, so we've got that situated for you there. Now I will get my stethoscope. This stethoscope is perfectly utilized to get a nice reading of that heartbeat. We'll utilize this as well for our heartbeat test and our lung breathing exam. But for now, please, that same arm, I will slide this right next to the cuff and on that pulse. All right, coming in close, I'll hold it with that same hand I'm holding that stethoscope with. And let's go ahead and get that air pressure going. That's perfect. You are doing fantastic. If you were nervous for this, I would not be able to tell. yes, as you can feel, it's getting quite snug, but I told you it wouldn't hurt at all. It's not a problem. Good, 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 good. Almost done. Doing great. All right, so let's go ahead and let's let a little of this air out. Good. Now it's loosening up and listening. Just listening for that pulse. Listen. And there it is. All right. Let's go ahead and loosen that cuff up here. Just getting that undone there. All right. I told you nothing to worry about, and you'll be happy to know that your blood pressure was perfect, which means I do recommend that you get yourself a bike. They are really handy to get around, especially on the bike path, and they're quite fun. So, all right, the next thing that we will do is we are going to go ahead and sanitize the stethoscope for your heart and lung exam. Give me one moment. Now, before we begin the next portion of the exam, I'm just going to use a few alcoholic prep pads here to sanitize my stethoscope and make sure that it is perfectly clean and sanitary before we use it anymore. Since we utilized it on your arm, now we're going to use it on your upper back and right at the top of your chest for your lungs and heart exam. So these alcoholic prep pads are great for that, and we utilize them for quite a few standard practices here in the Pokémon Center. So if you will allow me, I will go ahead and get one open here. All right, so we will go ahead and get our stethoscope nice and cleaned up. We want to make sure everything is nice and sanitized. All right, I think that is perfect. So what we are going to do with this is I will come in quite close. I'll place one hand on your back and one hand on my stethoscope and place it right on the upper portion of your chest to listen to that heartbeat. I'm just listening for the regular beat and hoping to not hear any abnormalities or anything like that, and I'm sure we won't, but we want to make sure we're thorough just to give assurance that you can push yourself as hard as you want out in the field and not have anything to worry about. So I will come close here. I'll place this hand on your back and this here. All right, just remain quiet as you can. I'll be listening here through my stethoscope, and I'm just listening for any issues or problems here. That's sounding great so far. Good. Almost done, don't worry. Perfect. And almost done. All right, perfect. Absolutely no problems. A beautiful beating heart there. So you have done a very good job taking care of yourself. Excellent. Now, Very similar process, except now I'm going to place the stethoscope on your back, and I will be listening and asking you to take some very deep breaths and then prolonged exhales. I'm listening for your lungs' abilities to pull in the maximum amount of oxygen and then very efficiently exhale the carbon dioxide after the blood is oxygenated in your lungs there, of course. All right, I'm going to come in quite close here. I'm going to place this right on your back and breathe. Hold it. And exhale. Great. Exhale. Breathe. Hold. Exhale that air. That's great. Exhale. That's great. Another breathe. Big deep breath in. Come on. Big deep breath in. Good. Hold it in. Good job. Hold it in. Hold. Exhale all the air. Good. Big deep breath out. Great. Good. All right. I'm going to come around the other side. You're doing excellent. There we go on the back and breathe and hold it in. Hold it. Exhale. Good. And breathe. Hold. Exhale. Great job. Big deep breath in and hold. Exhale. Great. Another big deep breath in. Breathe. Hold. And exhale. Great job. That was fantastic. Your lungs sound perfect. Great job. So we are done with the stethoscope here. You are doing absolutely fantastic. I told you there was nothing to worry about whatsoever. So the next thing that we're going to be doing is we will step aside here into a bit darker room and check some of your eyes here. What I'll be utilizing here is my pupil dilation pen. As you can see, there is a pupil dilation indicator here to show the health and proper dilation of your pupils. I'll be utilizing this pin light here to see how your eyes react to different light stimuluses, but we always do it in our darker room just so I can focus just a bit more on what I see. So let's go ahead and step here to the side, just through that door there. Let's go. All right, that's perfect. So I'm just going to shine this light just a few different angles here in your eyes, and I'm going to ask you to do a few different exercises here, so just bear with me. The first thing I'm going to do is just get a nice look at your pupil for this dilation meter here. So please hold perfectly still, and I'm just going to do a few different angles here. Just going in close and pulling back. Close, and back. Perfect. Let's go here from the bottom and quick shines. Just quick flashes of light, quick shines. We want to see how you're going to react to rapidly changing brightness levels. That's great. Perfect. And quick. And can I surprise you here? And there it is. Perfect. Now you're doing great. Let's go from the top here. So, quick flash of light. Perfect. And there it is. Perfect. Coming in. Perfect. Let's go. Gotcha. All right. I'm going to really try to surprise him here. Sometimes pupils can give you the most problems when you're least expecting it. So, am I coming from the top, bottom, or side? There it is. Oh, that's great. Where am I coming from? Top. Oh, that's perfect. And bottom. Still looking great. Side. Okay. What about here? No, that's good. Where will it be coming from? This side. Okay, that's great. And right there. That looks perfect. So, one more. Close, 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 close. And pulling it back. That's good. And close, 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 close. And back. You are doing great. So, what I'm going to do now is I'm going to ask you to follow my pin with your eyes here. And I'm going to shine the light from different angles and make sure that you can remain focused while having different light obstructions. This is very important for throwing that Pokeball accurately when you are in a very bright environment. Are you ready? All right, remember, watch the pin. Here we go. And from the top. And how are we looking here? Watch that pin. Good. 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 Watch that pin there. Good. Almost done. Watch that pin. Watch that pin. And if we pull it back, how do we look here? Can you focus a little further away with that light shining? How's that looking for you? Let's go here from the bottom. How's that? Can you still see that? That's great. What about here? Mm-hmm. And let's go from the top. Can you still see that? Great. And here? Let's move that back up just a bit and see if that light affects your ability here. That's looking good. Still focused? Doing the best you can. That's great. That's perfect. Okay. Now, I'm going to try to move the light around slowly to see if... Yeah, no problems. Okay. Now just some simple following the light. All right? Please follow it. Don't move your head. You're going to want to keep that head perfectly straight. Don't move it from side to side at all. And I just want you to follow the light with your eyes. Eyes alone, not your head. So no head movement, just eyes. Make sense? All right, let's begin. Focus. And let's move those eyes. That's great. That's great. Good. Just follow the light. Let's go here. No head movement. You are doing perfect. Great. We're going to go to the center and up. Back down. Good, good, good. Up. Let's make a little square here. Good. And cross pattern. Good. How's that? That's perfect. All right, let's go a little quicker now. Good, 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 good. Keep it up and to the diagonal side. What about up? I cannot believe how well you're tracking this. That's great. That's all I need to see. Your eyes are perfectly pristine. Excellent job. Let's go ahead and let's head back into the exam room. Perfect. That looked absolutely fantastic. Great job. It seems that that is just par for the course for you. Everything working in peak performance. So the next and last thing that we will do is we will get a nice little look at that leg and a quick bandage here. I have multiple kind of bandages here. It does look like you have some substantial bruising there, perhaps just a few abrasions, and yeah, I think we're going to utilize a few of our bandage options. What I will do first is I will place just a bit of this gauze here. This will be the initial layer on your bandage. This provides a nice, soft, comforting layer between your skin and the more adhesive bandage types. As you can hear, it's quite soft, very cushiony, and this will make sure that there is no discomfort on your leg from the bandage or any of the more, like I said, adhesive type of bandaging. So it still is slightly adhesive in nature, but nothing like the traditional tape that we will be utilizing as well. So it tears very easily and has a nice consistency to it that I think you'll find quite enjoyable. Not a problem. So I will get a decent strip here and get a nice layer around that leg before I do some more of the more hard wearing tape. Okay, so allow me here. I'll get a nice long strand. All right, and I will get this bandaged here. That's looking good. All right, and we got a nice, good layer there. And now we will start with some of the more protective tape. So this tape is a nice hypoallergenic and antifungal layer. This will prevent any moisture accumulation on the bandage. As you know, anytime you have layers over the skin, it does have the tendency to get a lot warmer than your just normal surface level skin. So this will help provide a nice barrier and keep everything perfectly sanitized and clean and comfortable. It has a nice breathing, porous feature to it that will be perfect for this type of injury and will provide a perfect middle layer. As you can hear, it is still a nice cloth type material, but is quite more sticky than the other pre-layer that we just applied. So we will get this prepared. As you can hear, the adhesive is quite strong, and it does hold much stronger when applied. That should be a decent size for us. As you can hear, that adhesive ability is quite remarkable with this tape. we will go ahead and get this removed and onto that leg, so bear with me. We're just going to get that nice and tightly wrapped here. Make sure there is no chance for re-injury. Just a bit more. Almost done, and perfect. All right, so the last portion of our tape will be this very sturdy and tough protective layer of tape that will go on the outside of the previous 2 layers that we have already applied. This will keep anything, any dirt or debris or any kind of things that could damage the area. This will keep them away and keep that injury protected and keep the other 2 layers of tape protected as well. This is just a more traditional and tougher fabric type tape, as you can hear. Yes, it's more like a weave type of pattern here. So let's go ahead and get that tape out. I think we will get a different piece. Let's try that one more time. As you can hear, very sticky. Alright, and careful not to crease the tape, and a nice clean tear. We have our perfectly cut and torn to length piece. So allow me. Almost done, and we will get that wrapped and perfect. All right, so we have your bandage completely protected and nicely bandaged up to keep any further injury to that spot. With that said, that is the last portion of our general checkup. Everything looked perfect, and I think you will make the absolute best trainer in the Kanto region before long, because you are in perfect order to perform. I do assume that Chansey is almost completed with your Pokemon's general checkup, and I expect nothing less than the same from your Pokemon. Let's go ahead. I will do one thing though. I'm going to go ahead and get you a prescription written here. I do think that it would be smart to keep 2 full heals on your person for you or your Pokemon. And yes, you can use those full heals on yourself as well. Just, don't tell anyone. All right. So 2 full heals. And you can pick these up today from the Vermilion City Pokemart if you'd like, if you have time. I'll send this prescription over immediately. All right, so we have that done. And yes. Chansey, how was the Pokemon? Perfect. Your Pokemon is in tip-top fighting shape. Great job so far. I thank you so much for coming in, and I am so glad that your health is in such robust nature. So if you have anything that gives you issues, or if that leg needs a rebandage, or if there are any further injuries, please do come in, see Nurse Joy at the front, and we'll get you an appointment scheduled. Thank you so much, and please do be careful on your journey. Have a great day. Goodbye.